Okay, everyone. Well, I want to say welcome. And for you that are joining us, Shai, we have someone from Hong Kong here. Just a deep bow because it's really late at night in a lot of places in the world right now. And I know for Emma and Hong Kong, it's sort of afternoon time. So thanks so much for showing up. I'm Buffy Trupp, founder of the Mindful Fertility Project, and I teach mindfulness to women and men who are struggling to conceive. My website is themindfulfertilityproject.com if you're interested in learning more about how to use your mind to heal your body while trying to conceive. Tonight, I have a very special guest for you. I'm very excited to introduce Emma Park, holistic nutritionist and microbiome expert. I was researching the microbiome online generally, but I'm always interested in fertility. A couple of months ago, and I came across an article that Emma had written, and it was excellent. And so we got in touch sort of right away. And so I'm really pleased to have Emma here today sharing information with us. I want to say a little bit of background. We've already had one discussion. It's about a 40-minute recording that's looks at the microbiome generally and talks about factors that affect the microbiome. We're going to go over that briefly today, but I've put it in the chat. If you're just joining us, I've put the link to that interview in the chat. So it's really worth checking out and hearing all, more that Emma has to say. We're going to get really specific about fertility tonight. Emma, so pleased you're here with us. Thanks for sharing this information.
Great to be here. Thanks for having me. I'm really passionate about this field and what it can do to help not just fertility, but general health and wellness, but particularly fertility. And I kind of got involved in this field because I work for a company that makes a pregnancy probiotic, and that's how I've had to really stay on top of all the research. And the more I learned about it, that's how I ended up actually writing that article about the fertility, was researching the roles that having a disrupted microbiome can play, in fertility. So yeah, it's been really fascinating journey for me as well. So yeah.
Thank you so much. It's an emerging field, which is why I've wanted to really highlight it here. And you're just a wealth of information. So really lovely to have you. Let me tell you a little bit more about Emma. She has a Bachelor of Health Science in Nutritional Medicine. She's done postgraduate training in all things biochemistry, which we love when we're talking about fertility, of course, endocrinology, mental health. I always get this wrong, methylation, which I just heard an incredible, Brandon Horn, who's a Chinese medical doctor, just did an incredible presentation on myelination and its role in fertility at a conference I was just at. So gastroenterology and nutrigenomics. Yeah. Wow. So which means she's well versed in how our diet, nutrition, and lifestyle affect our function, health, and vitality, including fertility. So before I hand it over to Emma, because she's really who we want to listen to tonight, I'm just going to say a few reminders. If you come in, please mute your microphone. You can choose to have your video on and off while you're with us today. And also try and open your chat. It's usually in the toolbar above or below. And so, hi, someone's just come in. If you could mute your mic, it's usually in the toolbar. That would be great for us. And then go over to the chat and introduce yourself. Tell us where you're from, what time it is where you're from. I'll be sharing other resources, which I've done already in the chat. So it's a really good thing to have open while we talk here. Great. So questions. We're going to have a question time at the end. I've already had lots of questions come in via email. So we'll get to those at the very end. Take notes and make a note of your question, and we'll ask you to ask them when Emma's finished with her presentation. And then also at the end, I'm going to talk more specifically about how you can work with Emma. She's offered us a really incredible deal tonight, so you'll want to stay around for that. And I'll give you the link of how to, how you can work with Emma and the special offer we have for you. Okay, so without further ado, Emma, I'll pass it on to you.
Great. Okay, cool. Thanks for having me. So let's get into it because we've got lots of info to get through. So first of all, we'll just have a quick overview of what we did in the first webinar, because we'll probably use a few terms that you may not be familiar with if you didn't hear it. So essentially what the microbiome is. So it's all of the bacteria and microbes that live in and on us. We speak a lot about it to do with gut health, because the greatest concentration of those microbes are actually in in our gut, in our large bowel. They are everywhere on the body. Their reproductive organs have their own microbiome, which is different to some of the other areas, but the way we work with the microbiome is generally through the gut, because it transfers to the rest of the body as well. The microbiome was discovered when they were sequencing the human genome, when they found a lot of DNA fragments when they were looking at that actually weren't human. So they were able to have a look and go, well, why have we got all this genetic material that's not ours? And then it became apparent that we had all of this microbial organisms living in and on us. So it's amazing the more we learn about what they're actually doing and the roles they're playing, into how important it is to have a healthy balance there. What disrupts that? Generally, lifestyle, environment stuff, toxins, environmental toxins, dietary toxins, even just diet as in sugars and refined carbohydrates, pesticides, chemicals, things like that. Stress is a really big one. That's one of the things we're going to have a closer look at today. Medications is another very big one. We talked about that last time, about antibiotics particularly and what they're doing to that microbial balance. Other medications as well, and that can create a condition called dysbiosis, and we will refer to that a lot today. And the dysbiosis is an imbalance in that flora that's causing a problem in either the lining of the gut or in generally the linings of the other sort of organs as well. And then we had a look at what's the role of the microbiome in fertility, and essentially it comes down to three main elements, which is the immune modulation, inflammation and infection. So they're the kind of things. So have a bit more of an understanding about that, go back and have a look at the other webinar.
So I'm just going to say here, I'm going to link in the chat. So go ahead and open your chat to some of these resources that Emma's talking about right now. Yeah, thank you so much, Emma.
No worries. The other thing we did talk about was how that we rebuild and maintain that microbiome. So a lot to do with diet and lifestyle, and there were the resources, that was some handouts that you can download as well, that Buffy will put in there, that some resources that you can use for ongoing information, how to sort of incorporate those diet and lifestyle things. So the focus of today's webinar was a bit looking at a couple of more microbiome related conditions that are a bit more specific to infertility, and just having a bit of a dig into them that might be contributing to that infertility. We're going to have a look at stress in a bit more detail, what that's doing to us. Looking at digestive signs and symptoms that might indicate that we've got a microbial imbalance, and there's a lot of those things that we're not familiar with as well. We're going to have a close look at inflammation, and then we're going to look at the targets that we can look at for specific microbiome related conditions that might be affecting fertility. So there's a few slides that I've got that we'll get into, because it helps to have a bit of a visual. So we'll get started. So first of all, we're going to have a look at stress. So just as we said that technology was working, right? It's working. All right, cool. So the first thing that we think about with stress and the microbiome is what that stress response is actually doing to the gut. So it's doing, there's a few different things it's doing that's impacting our microbial balance, but it's also impacting that digestive function and gut function. So if you go straight up and looking at gut motility, that's actually the term that means that the peristalsis and the movement of the gut, so the natural movement of the gut that's passing the food through and getting the digestive system working properly. So it's not just actually when there's food in there, there's also another motility complex, and that's called the migrating motor complex, and that's the thing that's happening in between food, and that's actually more to do with the microbiome and moving bacteria through, or pathogens or things that shouldn't be there. And I see this a lot in people that have had chronic stress, or that are in high stressful jobs, or for whatever reason, that they have this reduction in their migrating motor complex, and that can directly cause a lot of these imbalances in that sort of gut microbiomes. Moving around, if that term paracellular permeability, so a better and maybe more common term that you may have heard is leaky gut. So that's when actually the cells that line the tube in the digestive system are supposed to be nice and tight together, packed together like this, and not let things through. So when we have leaky gut, it's this increased permeability between the cells. And so that starts with that stress can cause that opening of those gut cells, and then we have things passing through that shouldn't be getting through. So that's what it means by that paracellular permeability. So too much permeability in the lining, direct impacts on the actual gut microbiota. So the term microbiota is talking about the individual organisms. So the stress response can actually change the pH level in the gut. It actually sends those, so the stress hormones like your cortisols and your adrenalines and things like that have a direct impact on those microbes in the gut. So it actually changes the profile, encourages the overgrowth of the pathogenic bacteria, and it can really dampen down the protective guys that live in the gut. Another thing it does is really impact the mucosal blood flow, so the mucus lining around the gut as well. So part of the integrity of that lining is the mucus layer. So it's really important for protecting us against things that are inside the tube that shouldn't be getting through. And the stress is having direct impacts on that mucus lining. It increases the visceral sensitivity in the gut. So that, again, is making us more susceptible to toxins and food. You know, when you start to see food intolerances and those kind of things, that's when you've got this visceral, what we call hypersensitivity. And it's also impacting the secretion of our digestive enzymes. Right. So when you're in a stress response, it's a flight or fight response. So it's a physiological adaptation to stress to get you out of danger. So in that moment that you're in fight or flight, it's a survival mechanism. So in those moments, the digestion isn't essential for survival. So it's shutting down all of that digestion, and because you don't need it in that moment. But we're only supposed to really use that stress response for, short amounts of time. And then what we see a lot in this day and age is that people are under this stress in a chronic sort of form, rather than being able to run away from the tiger and then go sit down under a tree and rest. We're spending our lives running away from tigers and, trying to get out of danger, or, we all know the stresses that are in our world. So it's just looking at direct impacts on the gut and what it can do to microbiome balance. There's enough there on itself. And then if we start to look a bit more systemically, so what's actually happening when there's high levels of cortisol and adrenaline running through the body, what's happening in the body in response to that. So it's not just in our gut that's being impacted. There's all of these other end organs that are actually having an impact from that stress. And that's one of the things that's then really contributing to our infertility, among other health conditions. So if you just kind of have a look at the hormone response, for one, it's got direct impacts on the hormone response. So you may have heard about the HPA axis. So it's what actually controls our stress response. So it's the hypothalamus, pituitary gland, and then the adrenal glands, the HPA. So that's the design to get the message in our brain we're in danger, and it sends the message to the pituitary gland to flood the adrenals with hormone to release cortisol. So that system also controls our gonads, which is our ovaries in women and testes in men. So that's what releases our sex hormones, and also our thyroid. So the thyroid that's controlling our basal metabolic rate and all that is governed by the same system. So when that system's on overdrive and going all the time, it's not just affecting the adrenal glands, it's also then affecting the other organs. Not to mention having high levels of cortisol running through your blood all the time, like that does to blood sugar. So you can see that pancreas is one of the things that's impacted through that metabolism response, so thyroid, pancreas, liver, a detox, like it's going to slow down our detox systems because it's not essential for survival in that moment to be detoxing. Has great impacts on our inflammation and our immune response. Cortisol in a short term is an immune stimulator, but in the long term it dampens down our immune response. And it's really one of those things that's part of that ending up having an autoimmune condition as well, is that chronic stress. A lot to do with that as well is that increased permeability in the gut, the leaky gut. So I'm sure most people are familiar these days with the fact that our immune system sits in the lining of our small intestine. So when there's dysbiosis, when there's inflammation in the gut, when there's when there's increased permeability, like we were talking about before, that contributes a lot to that disrupted immune response and a confused immune response. Obviously, it has impacts in the central nervous system, in the cardiovascular system, so we know all those things. So, but specifically to fertility, stress is having impacts on these organs that are directly involved with fertility. So, really important thing to be managing.
You know what I want to say, Emma, before I just love the slide I said to you earlier. I was like, wow, yeah, this is kind of ground zero for fertility. You know, when we're treating fertility, I mean, I'm working with the central nervous system and the autonomic nervous system, of course. And but, you know, when you look at Chinese medicine and all of the research and all of the, you know, talks I've been to and the people that I know that are treating, we're treating all of these gray dots. We're treating thyroid, right? We're treating adrenals. We're treating the central nervous system. We're treating GI now because we know, so, you know, the microbiome, the immune system, absolutely, right? And like you're saying, it's just, this is all really related to so much stress.
Yeah, absolutely. And again, if we don't take stress out of the picture, then we can really do so much. Or if we don't consider
address
it and address it and reduce and part of my treatments, whether I'm treating fertility or not, we always address stress because of the impact it's having on everything. Stress is as big a risk factor as smoking is for cardiovascular disease. So that can tell you what, you know, the kind of impacts it's having on the body as well. So it definitely needs to be taken into account. Reduce the amount of stress you're suffering, increase your coping skills, and also support and try and reduce the physiological impact that stress is having on you. So again, supporting those sort of downstream effects of it as well, because sometimes it's unrealistic for people to reduce the amount of stress that they're exposed to, like circumstantials, if it's occupational, those kind of things. We give you tools and you need to practice them, like your mindfulness and your meditation and those kind of things. So it's really important because sometimes you can't get away from it.
Right. What I love so much about mindfulness is it changes your perception and your state of mind, right? Yeah, so you can be having you don't have to bail from your entire life, right? But you can really see it differently, including the challenges of conceiving. And it's just so effective, as we know.
Absolutely.
We'll talk more about that.
So a huge part of it. So, and the other thing that we do by, you know, reducing the stress is then, you know, we can have better results in the healing process as well, like the physiological healing process that we need in the gut as well. So we might move on to having a look at that gut and what you know the signs and symptoms might be of a dysbiotic gut, right? If you look in the middle of this picture here, pardon me, where it says SIBO, so this is actually a picture I found that's talking about SIBO. So SIBO stands for small intestinal bacterial overgrowth. So that's actually one form of dysbiosis. It's a very, very common form of dysbiosis, and it's concentrated in the small intestine. But I liked this graphic because it actually is indicative of sort of systemic dysbiosis. So even if the dysbiosis is in the bowel or the stomach, then these are similar and that have similar symptoms. And what else I like about it is it's got things on there like depression and skin conditions and fatigue and joint pain, which people are not familiar with actually indicating a dysbiotic gut. But that's because I get people all the time, oh, no, I'm fine, my gut's fine. But I've got headaches, I've got inflammation in my joints, I've got bad skin or rosacea. It's a really common one. You know, fatigue, foggy head is another one that's not on here. That's such a common sign of having that sort of dysbiotic flora in the gut. And the thing is with dysbiosis, if you've got dysbiosis in the gut, you're likely to have dysbiosis in the other areas of your body as well.
This was a question for me in the endometrial lining, and you know that's really relevant. And so we're not just, it's usually not just gut, say, or stomach or intestines. It's
so
probably systemic.
Generally starts in the gut, but the theory is that the rest of the body gets its flora from that sort of concentration in the gut. We look at that when we are pregnant, and then when we're breastfeeding. The theory is that the the dendritic cells in that enteric nervous system go down into the gut, and they peek through that lining, and they grab the bacteria and take them up into the breast milk for passing on to the infant, which is pretty amazing. So when you start to think about that, you know, like that, having a healthy gut flora is going to lead to, you know, having a healthy reproductive flora. And, you know, people that are suffering from dysbiosis and they've lost that, you know, their family of lactobacillus, for example. Lactobacillus is the most dominant strain that's in reproductive organs. So if there's none in the gut, the chances are there's none in those reproductive organs either. So
I've got another question for you here. Would there be, because when I think of dysbiosis in the endometrium, in the uterus, for example, would there be, in addition to these symptoms, say, other symptoms, like I just think of clients that have had like that urgency to pee, which sometimes we think of as a stress symptom. I think of certainly vaginal, you know, infections. Are there other symptoms that are, you know, that you will notice, say, in your reproductive organs?
Anything that's inflammatory. So anything inflammatory is an indication that there's dysbiosis, because a healthy level of good bacteria is naturally anti-inflammatory. So if there's inflammation going on, then chances are there's no good bacteria there to help dampen down that inflammatory response.
And those things I was talking about, you would call inflammatory, for example. Me too.
Absolutely. Even sort of any of those conditions that are contributing to infertility, like endometriosis or even, you know, cysts, or even painful periods, dysmenorrhea, you know, like any of those things are going to have some element of inflammation going on. We're going to have a closer look at inflammation and what it's, how it is quite the core of what's going on in our health condition. So any kind of imbalance, any kind of immune problems, or when there's any kind of autoimmune condition, which is a dysregulation of the immune system. We used to see autoimmune conditions as a hyperactive immune system. We have this better understanding of it, that it's actually really quite dysregulated. It's more to do with the signaling systems in the immune system, and that all starts in the gut. It absolutely starts in the gut, because that's where your immune system's sitting. And when there's pathogenic bacteria or an infective agent or something that your body sees that it needs to mount an immune response to, that's happening in the gut. So that's where those autoimmune conditions are starting. And endometriosis is a classic autoimmune condition. So, and a lot of people know that. I find that, you know, like a lot of these conditions actually have their roots in that sort of autoimmunity, so that dysregulated system.
I think too, especially with endometriosis, you know, we've sort of like, it's kind of been billed as an endocrine, you know, a lot of estrogen and really, and there's literature out there that says really estrogen plays a part, but it's not the cause, and it's an inflammatory, you know, condition. But I think there's a lot of a misunderstanding about it.
And I think that, like, I've heard people say, you know, in the future we won't have specialists, like organ specialists, as we do now, you know, cardiologists and endocrinologists, and, you know, one particular system, you know, that actually the specialists are going to be inflammologists, because it's actually, it's inflammation that's driving everything. And even if your inflammation is presenting in a joint or in the uterus, or, you know,
the bowels,
it's starting from the gut. And if we don't go back and sort of treat that on that level, then we're only really doing symptom management. We're actually not getting to the cause and the driving factors. So I think you know, people tend to see digestive signs and symptoms as the ones that we always think about, like, you know, diarrhea, constipation, bloating, food, you know, allergies or intolerances, things like that. But if you have a look at it, it's actually sort of almost anything, you know, like that, headaches and skin conditions and inflammation. So if you think that you don't have a dysbiotic gut, well, you know, you still actually might. And because of those things, and that we talked about in the first webinar, it's very hard to avoid all of those things in our world these days. Very hard to avoid chemicals and toxins and pesticides and stress, as we've discussed, you know, like, so that's there's not many people that haven't had an antibiotic in their life, so
just to plug the interview, the first interview that we did is in the chat, so go ahead and look there and really check it out. It's got some great information.
And so chances are there's some kind of compromised microbiome
issue.
Absolutely. So if we flick over to the next slide, that's my job. Here we go. So sort of thinking about what we've talked about already. So some of the targets for treatment when we're starting to think about inflammation and what might be driving that. Obviously, stress is what we've talked about. Digestive issues as well, because that we know that they are indicative of having a dysbiotic flora in the gut. Dysbiosis in other areas as well. So there's the dysbiosis is not always just in the gut, obviously, is what we discussed when we're seeing bacterial vaginosis, when we're seeing candida infections. So candida infections are very, very common, as so is bacterial vaginosis. But candida is a little bit different because it's a yeast, not a bacteria. And it can present in other areas as well. So oral thrush, like people may not have seen that before, but it's very common to have a white coating on your tongue. So that's indicative of that candida. But even things like tinea, athlete's foot. So athlete's foot is a fungal infection. So even if it's not actually Candida albicans that is causing thrush, it's still a fungus in that family. So it might not be a bacterial overgrowth. It can actually be a fungal overgrowth as well. And in saying that, the other thing that can happen in that microbial imbalance is viruses. So viruses are part of those microbes, not just bacteria. There's more bacteria than anything else, but viruses have a big part to play as well, because quite often viruses get into our system and they stay in there. So you're probably familiar with glandular fever and chicken pox and those kind of things. So they stay in our system, and then they flare up when the immune system comes down. So viruses are very, very clever. They steal our DNA into our cells. They live in there until they can come out. So quite often, some of the symptoms that you see can actually be from people having an increased viral load as well. So it's not just dysbiosis where it comes to bacterial and funguses, but there can also be dysbiosis systemically from an overgrowth of bacteria and viruses as well. So these are the kind of things that we look at when we're trying to identify what might be driving the problem. So you get your symptoms, and then you start to dig deeper, and you're actually looking into what the driving factors are, because you can maybe treat the symptoms on this kind of level, but you can get symptom management or maybe a bit of relief, but you're not going to fix the problem unless you dig deeper. And these are the things that we look at. So inflammation, as I said, is a big one. I've got a great slide coming up next that really has a look at that inflammation a bit more closely. Obviously, hormone imbalances are playing a part in infertility. Huge. Absolutely. But what's driving the hormone imbalance? Again, so and that's what we're looking at. Why have you got hormone imbalance?
This is so key. This is so key.
And then autoimmune conditions, as we discussed, because that has its roots in that gut and the signaling that's coming from the inflammation in the gut. So
can I have a question for you? This actually reminds me of a client that I had, but when you were talking about viruses, can you have sort of can some of these dysbioses or issues that are gut related and microbiome related, can they be asymptomatic, for example?
Oh, absolutely.
Yeah. I had a man come in, and it was an unexplained infertility, and he was doing the meditations along with his wife. They're sort of based on the physiology of the woman, but the mindfulness teachings are, for everyone about the mind. Anyway, he was doing these, and it increases your awareness. And he just had this insight that he had, it was sort of like you're describing, that there was a viral condition that was asymptomatic and not addressed. And sure enough, he went to his doctor and he insisted, and the doctor was like, this isn't really relevant. And treated that condition, and that's what helped them conceive. They conceived a short time later. It blew my mind. And it sort of reminds me of what you're saying. Absolutely. So it's
dysbiosis is a term that means imbalance. So be an imbalance of any of that sort of microbial community that lives in and on us and in different organs as well. So the reproductive flora in men also has, you know, they in the testes, they have their own flora. Again, it's like usually lactobacilli dominant. And so if there's a big viral load, then that can really have an impact on the bacterial level as well. So cool. It's a unit or almost an organism of its own, and whichever one is out of balance is going to throw the other ones out as well. So that's,
and I just, you know, what I loved about his story was like, don't take no for an answer. That's what he really learned. You know, all the professionals were just saying, you know, it's not relevant. And he, you know, through awareness training was like, it's relevant and it's happening and we need to find it. You know, he was so sure about it. It was incredible. Yeah, it's
awesome. It's so good when you can actually instill that sense of instinct in somebody as well. A part of, I mean, unfortunately, our healthcare system isn't really designed to look for causes, and that's the thing. You know, treat symptoms. So by working with a holistic healthcare practitioner, you're digging for the causes, and that's the chance of actually, you know, finding out. And that's what you're doing by doing the mindfulness. You're actually digging into, you know, you get more really specific information about what is happening in your body when you take when you take the sort of automatic perceptions off. You know, and you start coming into the moment without the judgments, and that's the hard beginning part, just sort of dropping those and this image you have of what's happening. When you kind of just spend lots of time with the body as it is, awareness is in every cell of the body. It has the information, right? But it takes some practice to gain that insight. And then you combine it with this, you know, like the digging into the physiology and what's going on. Driving, you know, so powerful. So it's really exciting. Anyway, okay, cool. So let's have a look at the next one. So I found this slide as well, which I really like because it actually really explains how inflammation is at the core of everything. So if you just go straight up from inflammation to gut dysbiosis, so gut dysbiosis causes inflammation, inflammation causes gut dysbiosis. And then if you look over to the right there and you can see stress, you know, like which we've already talked about, all of the things that the stress is doing, and it's also feeding back into that inflammation. It's feeding back into that gut dysbiosis. Look, we haven't even really talked about anxiety or depression, but you know, there's a theory now with our holistic or integrated psychiatrists that are looking at inflammation driving an inflamed brain. And you know, and it's absolutely what's going on. And then and that leaky gut, you know, we're talking about leaky gut, so it's leaky membranes. So it's not just the membrane in your gut, it's also the other membranes that are around your organs, like a leaky brain barrier. You've heard of the blood-brain barrier. And again, when I start to think about reproduction, so our reproductive organs have got a membrane around them that are designed to keep things where they're supposed to be and not only let certain things through. And this is the way our body works. So if there's leaky gut, there's leaky brain, there's leaky membranes in the reproductive organs. Another one of those signs of that leaky gut and dysbiosis is sinus infections and hay fever. A really common one as well, because it's exactly the same immune system that's working in every different part of your body. It's coming from that sort of the stuff in your gut. So again, as you sort of go around, you start to go, okay, the inflammation is driving all these problems, but it's like a vicious cycle. Once one starts, the other one gets worse. So, you know, and then it drives that. So I mean, in this slide, there's also, which is really nice to see too, sometimes there's ways that we can look at helping that. So a lot of the things that we take into account, the way that I treat as well, is by definitely looking at what the main symptoms are or what the main players are in that vicious cycle, and then using tools that come in and sort of help to dampen down those responses. And then we sort of, you know, we take a break in that cycle so we can actually get the body back into healing rather than it's promoting its own ill health or its own, you know, the inflammation driving its other things. So we start to unwind that and get everything settled down. So that's the way we sort of try and approach that on a holistic level of being able to sort of address the problems that can be driving that. So if anybody's interested, I'm more than happy to send out these slides in a PDF or
Great, thank you.
So that
they'll get them in the recording as well, but if they want, they can be in touch with you.
Yeah, you can always, when you're watching, and I quite often do this when I'm watching webinars and things, you can take a screenshot of them and then you can blow them up as well and have a closer look at it. But I really like everything that's on here, and they're all elements that I use in my treatments, like even things like turning off electronics and, you know, reducing light exposure at night. Sleep isn't something we haven't even talked about sleep yet, but how important that is to making sure everything is working properly. So yeah, I love this slide. Have a closer look at it when you've got some more time, because it's very it's really onto it. So wrapping up, we're sort of having a look at which I've already talked about this a bit, but the general protocols that we sort of take into account when we're looking into healing, you know, like how do we get to the things that are causing potentially that infertility. So generally, you know, when we're trying to dampen down that inflammation, we've got to remove the inflammatory environmental triggers and the dietary triggers. So that's where, by working one-on-one, we can really identify what those triggers are for you, because everybody has different triggers. Like we've got our common triggers like gluten and dairy, you know, toxins, you know, things like the glyphosates on wheat and those kind of things. And, you know, like it's pretty common that most people are reacting to them, but some people can be reacting to other things. And, you know, we can do testing, but generally just in a case taking, then we can sort of really sort of nail down what the triggers are going to be. Rebalancing microflora, so that's obviously key. Sometimes with people, if there's quite a you know, a dysbiotic state and there's an overgrowth of bacteria, we need to do a killing stage where we actually have to kill off the overgrowth of bacteria. So if we get to talk about the probiotic question, that actually covers that, because quite often people are like, oh, I haven't got any good bacteria, I'm just going to throw in a whole heap of probiotics and fermented foods and, you know, I'll be right. And it quite often makes people worse. It can be really, you have to be very careful with those kind of treatments, because a lot of the bacteria, they're not necessarily bad guys. We call them like the commensal floras, and they have a role to play, but they just need to be on a certain level. And if there's an overgrowth of them, by putting more sort of prebiotics and probiotics and other things,
grow them,
get them to explode. And it's about rebalancing. So that's why I'm very specific about the way that we rebalance the microflora. We do use systemic applications of probiotics if we need to, like if there is bacterial vaginosis or if there's candida infections, we actually treat that locally as well, so as using the gut. So providing a nutrient-dense diet is absolutely key. So it's not just about what you take out, it's about what you put in. So it's not just all of the prebiotic and, you know, the phytochemicals and all of that. It's all of the things that are, you know, providing substrates for neurotransmitters and hormones and, you know, all of your detox pathways in the liver, or providing a nutrient-dense diet that's high in fiber and really plant-based, so that the bowels are moving as we need them to be regular, and getting rid of toxins and all of those kind of things as well. So that's a big part of the approach.
So I want to just say the nutrient-dense diet that Emma has shared with us is in the chat. You can link right to it. It's phenomenal, as well as a little bit of a sheet about pre and probiotics that she's talking about. Okay.
So obviously part of a protocol for fertility is going to be having a look at hormones and that ways we can balance them. But quite often, to be honest, if we do the first 3 things on these protocols, then the others can sort themselves out. I mean, it depends where you're at. If you're at end stage autoimmune, well, it's going to be a bit more intense than just simply taking out these things. But quite often, after a couple of months, by just doing those things, where actually your body's natural state is to be in homeostasis. It wants to reproduce, you know, like there's a reason.
You don't have to teach it to heal.
You want to create the right environment for it, and it will do it itself. So it's about kind of nailing the things in your environment that are driving those inflammatory factors and those kind of things. And then
stress isn't specifically in here, although it's, you know, remove inflammatory environmental triggers. It's definitely sort of in that category, but it's so important. You know, the thing that I've noticed is it's kind of heavy lifting at the beginning, and you probably know this with it's heavy lifting. It's hard to shift these patterns and be really, consistent with the patterns. But once we've been doing it for a while, it shifts quickly. Do you notice that too? It's like once we really, it doesn't take the body a long time once you give it what it needs.
Yeah, exactly.
Yeah.
And I kind of find with people as well, it's about creating new habits as well.
Yeah, like that's the hardest part. Yeah.
The hardest bit, because you can give, most people know what they need to do. It's
right.
doing it. And part of that is that those habits, and that's why mindfulness is so effective, because it actually recreates the neural pathway. And so the pathway is like the path most trodden. So if you come to the paddock when all the grass is high and there's one path, you're going to go down the path, and that's the neural pathways in the brain. So we need to make new pathways, and that's what mindfulness does, and that's why it's such an important tool when we're trying to make change and create that healthy environment in the body. So
and the same thing happens, right? It's just like there's a beautiful meditation, it feels good, but it's just like I don't want to do it, and I got lots of other things I got to get done, and right. So I always say to people, just put it on for 1 minute. Right, because that usually leads to 5, and sure enough, and then you're loving it, and it's 16 minutes later, right?
Yeah, and I'll start just I'll do that 1 minute, and then and then they go, I haven't got time. I'm like, you do have time. I was like, you can fit in 5 minutes in their day. You can fit in 5 minutes, and then they're like, okay. So it is about, but when you want something enough, you
got it.
And it becomes, and then once you start to feel the benefits, then it's easy.
Self-reinforcing.
This is awesome. This is changing my world. This is changing my life. This is, fixing all my problems, and this is how I want to be. So it's awesome. So I guess essentially the other ones are just, part of that from what we're going to do, as well as balancing hormones or modulating that immune response, which is happening in the gut, and healing leaky gut. And that's a very big part of it as well, because you're not just working on the leaky gut membranes, you're working on all of the membranes in the body. So you can even go down to like a cellular level. So every cell has got its own membrane. And if those cellular membranes are leaky, well then, then what's that going to do to every part of your body?
Yeah.
And so, and even things like, essential fatty acids, and that's so common still to have not enough good fats in the diet. That's one of the things that quite often you're having to tell people, like poor old fat's got vilified for so long.
For so long.
I'm scared of fat still. And I just I feel so sorry for fat.
Yeah.
We need to get it back. And there's a lot of fat lovers out there now, but even just getting enough fat back in your diet can make such incredible changes to that the membrane integrity as well. So from a cellular level to the gut wall level to the blood-brain barrier and that kind of stuff. So that's why providing a nutrient-dense diet can have such phenomenal changes in your wellness on so many levels. So I guess these are the approaches that we take, and when you look at it like that, and when we look at what we've just sort of discussed, it just makes so much sense, doesn't it?
Yeah, that makes so much sense. Yeah.
It's not rocket science, but it's biochemistry, and it works, and it's also neural chemistry, and those things what we're talking about with mindfulness, and it works. It does.
And what I want to say to you, and I know you'll talk about this, and we've talked about it before, right? I find that it really helps to have a guide, right? We know all this, the literature's there. We're finding about a little bit more about, the causes that underlie some of these things that we know, how significant the gut is, and that microbiome is, in the reproductive organs, and can affect implantation. And these are the specifics, but we've known a lot of this information for a while, right? But what I want to just really say is that working with someone like you, right, having a guide, really being systematic with it, and the same with the mind, right? Really wondering what that dream means, or how stress, we use the word stress all the time, but it's really how is it that we're relating to our environment that's so out of view? It so helps to have someone helping us, doesn't it?
Absolutely and the internet and the blogosphere is a minefield. It's an absolute minefield. People are more confused than ever, even though there's more information. There's so much conflicting information, and it's like you need to find someone that knows what they're talking about for a start, you know, and that knows where you're at, and that you can work with and give you that kind of support. And I've seen, like, for myself, before I was a practitioner, like, I have been to many practitioners over my life, and I always saw a gap in that. You know, you'd go and see them, they give you all this information, and then you didn't see them again for 3 months, and what happens in that time. And so the other thing that I offer is email support in between.
Yeah, me too. I do a lot of that.
I do that, and it's because that's what I want. That's what I want when I need someone to help me. I've got my practitioners that I see, like I have a naturopath and I have a kinesiologist that I use, my 2 modalities that I use, and they're both available to me when I need them, and that's, I think, what you need to give. So, I mean, obviously available 24/7, but, you know, like 3 months in between seeing a practitioner is too long.
It's too long.
Change can happen. So I definitely, I think that extra level of service makes a lot of difference for my clients, because not everybody needs it, but some people really need to
absolutely.
And I think that makes a big difference too.
So we're in the last 15 minutes here, and I'd love to get, because we've got some fantastic questions that I'd love to get answered. Anything else here, Emma, before we kind of switch into?
No, that was the end of my slide. So yeah, Matt, more than happy to answer questions.
Yeah, great. I've got actually have a couple of questions that have come up, but let's go first of all to the people that are here with us. Do you have on this Zoom webinar here, some of you are staying up very late at night. I'm wondering if you have any specific questions. You can either unmute your mic and speak with Emma, or you can go ahead and type your questions into the chat. So if you have any questions, let us know. Go to the chat or unmute your mic, or if you don't know how to do that, I can do it for you. Raise your hand or tell me in the chat. Yeah, is everyone okay that's on the call? We've got a few questions that were emailed in, some really fantastic ones. So maybe we'll go ahead and start the questions, and then if you're on the call and you have questions come up, please go ahead and ask them. So, okay, great. Okay, wonderful. Yeah. So let's go. There's this incredible question. And Emma, you've had a chance to review it. Do you kind of want to just take it? Do you want me to sort of summarize, or do you want to just?
Yeah. Do you want to do the summary and then I can answer?
Yeah. So here's a wonderful question. I want to give you a little bit of the background. So I started to take, this person started to take probiotics for about 2 to 3 weeks, and she was noticing sort of a thin, yellowish, somewhat smelly vaginal discharge with no itching. So she stopped taking the probiotic. About 6 months later, around 6 months later, she went to her OBGYN who suspected the infection, the vaginal bacterial vaginosis, and did a vaginal swab, which came back negative. They also tested for trichomonas and manila, which were also negative. The OBGYN prescribed antibiotics. This woman did not take the antibiotics because in her opinion, there was nothing to take it for. So she is wondering, she's still having the discharge, and she's wondering if taking probiotics would help, but she's got reservations because it seemed to have brought on the problem in the first place. And she, along with that question is, can taking probiotics make things worse? I'd love to hear your response.
Yeah, sure. So first of all, my question would be, why did she start taking the probiotics in the first place? Because that gives me an understanding of the history and what's going on. But just knowing what we know, I would actually say there was probably the leaky gut and the leaky membranes going on. And so what happens with when you put probiotics in when there's that leaky membrane is that we translocation of bacteria. So we disrupt the bacteria that's kind of in there, and it gets into places it shouldn't go and disrupts the balance. So I would definitely say that although the tests were negative, there's something else in there there's definitely dysbiosis going on. And the fact that it's hanging around. But yes, probiotics can make things worse at the start, as I said before. If there's dysbiosis, by just throwing a whole lot of bacteria in there while there's leaky membranes, we get this sort of translocation. The other thing that can happen is you can get a die-off in that with the bacteria just by competitive inhibition, like you've put a lot of the things. And we don't know what's in there unless we do some really thorough testing, and there's not any testing in the world that's actually really that's thorough enough to give us a complete understanding of the microbiome yet, because we don't know all about the microbiome yet. We don't know about all of those different viruses and bacteria and things like that. So I would definitely say that, yes, that's what's happened at the start, but by potentially using the right strain of probiotic, that yes, help repair this this dysbiosis. So one of the other questions that she sent through was, what foods or supplements can help establish a proper vaginal bacteria growth? So a healthy balance.
Such a great question. Yeah.
Bacteria and sort of curb that bacterial vaginosis or the infection agent. And there definitely is. And if you remember, I said before, sometimes we need to use a killing agent. So we actually need to use something that's reduce that microbial load of the pathogenic bacteria, and we call those things antimicrobials. So there's antimicrobial foods and there's antimicrobial herbs, and we would use some of them in the short term just to sort of reduce that pathogenic load, and then we would go in with the specific probiotics or potentially fermented foods, depending on the case history. So again, it would be, like I can't give diagnosis advice without having the whole case history.
Of course,
so that's why when we do it, we spend a whole hour going through the case history so that we understand what's happening. And sometimes we do need to do tests as well. But just generally, antimicrobial foods, garlic is the best one. So some of the antimicrobials work in a similar way to antibiotics, and that is take out all of the bacteria. Right. So even that, because antibiotics come from bacteria themselves. Penicillin comes from mold. So, and most of our medicines come from plants as well. They come from, phytochemicals in plants. Yeah. So foods and plants are very, very effective and very therapeutic. So, but what I love about garlic is it's a selective antimicrobial. So it only takes out the bad guys, not the good guys as well. So that's always safe to use. So garlic you can actually use, quite safely. So I wouldn't worry about anybody taking that, unless people have FODMAPs and they can react to them, but that's a whole nother. That's a whole nother.
Yes.
So garlic would be a good thing. You can use a supplemental garlic where because people, it's you're going to get the smell and the smelly breath and those kind of things. But that's something. Coconut oil as well. So coconut oil is one of the ones we use as an antifungal as well. So as I said before, it could be viral, it can be bacterial, fungal. So if you just use an antimicrobial that targets bacteria, you're going to miss if it's a fungal infection as well. So that's again what I mean. Then that's why we use specific antimicrobials, and by doing by taking that history, I can get the clues as to whether it's fungal, bacterial, or viral. Like which actually one do we need to target? Right. So those kind of things can really help. There's other like antimicrobial herbs like oregano oil and wormwood, but again, you've got to be a little bit careful with them because they can sort of take out the good guys as well. And then obviously we're going to use the foods that will support a healthy microbiome, which is the prebiotics and the probiotic foods, which were in the handout that you can download.
They're in the handout on the chat. Yep.
It's also being wary of those things that might cause an overgrowth of bacteria, which is the high sugar diets or refined carbohydrates. Alcohol can be one that can actually disrupt the microbiome balance. So, you want to have a low sugar, low processed food, whole plant-based diet, which is what we talked about last time. So that's in that one. But again, in this case, you would be very careful about which probiotics you would use. And
that's the key, right? Yeah.
One of the other questions was, how do I choose the right probiotic? So all I can say in here is you need to get advice from a health professional because it's really hard. The way we do it is we look at the research. So the research strains are the ones that we use, because originally, and this is even when I first came out of uni sort of 5 years ago, it was, just use whatever you can, get as many in there as you can, get one of the highest dose, and there's been a big turnaround on that now, and everybody, all the science and all the practitioners that are sort of up on it are like, you know, we'll be so careful about which ones we use, which doses, which strains, and we need to look at the science behind that. So there's some specific strains that we would use for the vaginal flora. Families that we look at. So yeah, it's definitely going to be beneficial, but you do need to get the advice of a health professional.
Yeah. So I'm just curious about this. So what if the initial reason for the probiotics was IBS, say?
Yeah. So
similar answer. Yeah.
So leaky gut. So there would be a bit of leaky gut. Oh, you mean if there was a different case and there was IBS?
No, same case, say for example, but you were saying, well, I don't know why would you take probiotics why were you taking probiotics? Say if it was for IBS, there was, dysbiosis, say.
So that tells me there was dysbiosis, there was gut problems. So we would work on the gut first. So we'd put a probiotic in, we'd do that, we'd clean up the dysbiotic flora in the gut as well as in the reproductive organs. So we target both of them, and then do some gut healing as well. So we're at the same time cleaning up the diet, addressing stress, all of the things that are potentially contributing to that. IBS can often be caused by SIBO. Remember in that picture before it said SIBO, so small intestinal bacterial overgrowth. So that means that the bacteria has got into the small intestine where it's not really supposed to be. It's supposed to be in the bowel. And so if SIBO is playing part of the picture, then we need to treat the SIBOs particularly. So there's certain antimicrobials that we would use in that case that are going to target small intestinal bacterial overgrowth. So that kind of thing. Does that answer the question?
Great. Yeah. Thank you so much. Really wonderful. Okay. I'm just looking at our time here because I want to give everyone an offer. And I think those questions just answered a lot of, you need to know what's happening, the cause, and you really need to work with someone, right, to get really specific. It's not a general, let's throw probiotics at it, right? In no way. It can grow, the problem, if you will. Great. So, based on all of this, Emma and I really want to thank you for being here. And we want to offer you a fantastic deal if you're interested in getting started. So we're offering for $150, we're offering 33 unique mindfulness meditations. These are meditations that I have written and produced. They're natural cycle meditations, and they're also assisted cycle meditations, and there's a meditation for men. They really go deep into looking at the stress response, looking at how the mind is perceiving fertility challenges, looking how the emotions play a role in fertility. They're really an incredible resource for a lot of the aspects of the emotional mind health while you're trying to conceive. So for $150, there's 33 of those unique meditations. You can just click and buy now and download them. The meditations are $60. So I'm going to put a link in the chat tonight. Here's the link. You can go there. Oh, hold on. Let me just publish it. So you can go to the link that I just published. Click on that. It's $60. You get 33 meditations, and you can download them immediately. And then what we'll do, because you get the deal of Emma Part 2, which is essential, is Emma's offering us a 30% off her consultation rate. So you'll get an email when you buy the meditations from Emma that's offering you a consultation with her for $90. So that's $150 total, a $90 1-hour consultation with Emma, which is probably really invaluable if the microbiome is what's preventing you from conceiving. So the link's in the chat. Go ahead, and if you'd like to take us up on that offer, do it now. And we're so happy that you have joined us tonight. And there'll be a recording of this. So if you want to listen to it again, or if you want some time to just think about the deal and the links, or ask us questions, we'll send out an email Friday or Monday, and you can revisit. Yeah. Anything else, Emma, before we finish?
Oh, that's it for sure. Like, if there is any questions that come up, then just shoot us an email, and I'm more than happy to give you some feedback. Or if you think that, you just want to have a chat about whether, it would be specific for helping you, more than happy to
Yeah. You know what I want to say just before we close here, Emma, that one of the participants that's with us here tonight actually had the questions that you answered. And I think she would love more. She's texting me that she would love more information. If you have questions for her, do you have any questions for her specifically that she might be able to?
Yeah, well, it will mostly just be about her history and the other signs and symptoms and some of the things that would be driving that. Reluctant to, there is specific probiotics that could potentially help, but again, need to know a little bit more about her history. It's more about whether we need to do the killing stuff first before, you know, the antimicrobial kind of side of things before we went in with the probiotics. And, you know, there's not any other symptoms and everything else is fine, then you could probably just use a specific strain probiotic. But if not, we would need to do a bit of a protocol first.
Yeah, great, good. That's helpful. Yeah. So maybe she can be in touch with you.
Just send me an email. Yeah, for sure.
Yeah, great. Okay. Well, thank you so much, Emma. Just really such a pleasure to talk with you, and you're such a wealth of information again. So please go ahead and click on the link if you would like to take Emma up on her 30% off a 60-minute consultation and get some incredible meditations to help with the stress of trying to conceive. And please be in touch with Emma and I via email. Yeah.
Thanks.
Good night.
Good night.